Thank you for joining us today, everyone, for our COVID-19 update. Participating today, we have Dr. Rachel Herlihy, State Epidemiologist from CDPHE, Kate McIntyre, Deputy Director, State Vaccine Task Force, Kevin Klein, Director, Colorado Division of Homeland Security and Emergency Management, and Scott Sherman, Brigadier General. And we will start with our presentation and then end with the Q&A. For the Q&A, we'll use the raise hand function. And then when we get to that portion, I'll call on you and unmute you, and we'll go from there. But for now, let's go ahead and get started with Dr. Herlihy.
Good afternoon, everyone. So I want to start here where we normally do with our case trends in the state. So this figure is showing you our 7-day average number of cases reported by day. Each of the gray vertical bars shows you daily cases that have occurred in the state. And then the red line is our 7-day moving average, which we look at to follow trends over time. So what you can see if you look at those gray bars for the last couple of days, you can see that we saw a little bit of a dip. That's really coming off of the weekend where we think there was a little less testing occurring, probably because some of the community testing sites were closed due to weather. So we did see probably a little bit of an artificial dip in our case counts, but you can see that those numbers did go back up a little bit. But overall, we do continue to have this consistent downward trend in the state and continue to be in a good place as far as our overall trends. Next slide, please. This is a figure that we use to compare Colorado's position with our 7-day incidence compared to other states across the country. You can see that Colorado is kind of middle of the pack right now compared to other states. This is pretty similar to where we were last week. So we continue to see a decrease in the number of cases that we're seeing here in Colorado, but much of the country is experiencing the same thing. Increasingly, we are seeing some states that have more rapid rates of decline in cases than Colorado is seeing right now. But overall, Colorado and the US continue to be on a great trajectory with downward trends in cases. Next slide. This figure shows you our hospitalization trends over time. So you can see that, again, we continue to have a clear downward trend in the number of hospitalizations that we're seeing here in Colorado. We've certainly come a long way from our peak in early December when we had more than 1,800 Coloradans hospitalized on a given day. We're now down to 425 confirmed hospitalized patients here in the state. Next slide. This figure compares hospitalization rates in Colorado to the US overall. So a couple of things to point out here. So cases peaked earlier here in Colorado than they did in the rest of the country. So we were able to bend the curve a little bit earlier than the US overall. We peaked at a lower level than the US did overall, and we continue to have a lower number of hospitalizations per population than the rest of the US is experiencing right now. Next slide. And finally, I want to just provide a little bit of, finally, I want to just provide a little bit of information about variants in Colorado and what we're seeing as far as trends. So now in Colorado, we've experienced 71 identified cases of the B117 variant. This is the variant that was first identified in the UK. For variants under investigation, we have had 29 of these identified, and these are all the L452R variant, which has also been identified in California and Denmark. Just a reminder that there is a distinction between this variant of concern definition and variants under investigation. The variants of concern, like the UK variant B117, are variants where we've identified concerning characteristics of those variants. So things like increased transmissibility, variants that could potentially cause more severe disease, reduced effectiveness of treatments or vaccine, or that these variants could potentially be harder to detect with current tests. The B117 variant that we are concerned about here in Colorado and in much of the US, there is potential for that variant to spread more rapidly. That is certainly why we are tracking it here. There's also some limited data to suggest that it could cause some more severe illness. We have not identified the other variants of concern that are being tracked in the US right now. So that includes the P1 variant, which is the variant that was first identified in Brazil, and then the B1351 variant, which was the variant that was identified in South Africa. That variant and the P1 variant have not been identified in Colorado at this point. Those are variants where there is potential concern about effectiveness of vaccine or treatment, but again, we have not seen those yet in Colorado. And with that, I will hand it back to Heidi.
Yeah, sorry, I jumped the gun on your last one. Yes, Kate, we'll go ahead and take it over to you.
Great, thank you, and good afternoon, everyone. I want to provide you all on an update with vaccine distribution across the state. We have reached our 1 million mark. We have now administered over 1 million cumulative doses across the state of Colorado. And we couldn't have done this without working with all of our over 830 enrolled providers across the state. Of that 1 million, as you can see on the slide, the first dose has been 748,151, and second doses administered is 333,859. In phase 1A, we are confident that everyone who in the healthcare worker group was offered a vaccine dose was able to get vaccinated and with their first and second dose, and close to 90% of the rest of the people in phase 1A at skilled nursing and assisted living facilities has also had the chance to be vaccinated. In phase 1B, we are close to 90% of the rest of our healthcare workers across the state, first responders, as well as our EMS folks. In the 70 and above, our goal is to achieve 70% of those 70 and above in the state. And we are 86% of the way toward that goal. As you can see on the slide, 124 folks who are 70 and above have been vaccinated with their first dose. We will continue to vaccinate beyond the end of February, which is our goal, those 70 and above, to ensure that we're making progress toward vaccinating all of our 70 and above, which is over 550,000 folks across the state of Colorado. We've also made good progress on our goal of vaccinating educators and staff, as well as licensed childcare workers by the end of February, and folks who are 65 and above. And right now we are proactively planning for the other upcoming vaccine phases, and again, really appreciate all the hard work done across the state to get to this point. As many of you know, we have had some weather impacts to our vaccine deliveries into the state this week. Unfortunately, the weather not only prevented planes from getting off the ground earlier in the week, but it also prevented workforce from getting to be able to access delivering ancillary kits in Tennessee, dry ice in Kentucky, and vaccine production in Michigan. So despite that, there were big efforts last night to move to a 24-hour operations in order to get back up to speed as quickly as possible. And now it is looking like most of our shipments expected for this week should be delivered today through Saturday. So that's good news. We are doing our best to support providers who have questions or issues with keeping their appointments across the state, and we're actively working with the federal government, local healthcare providers, and vaccine providers to respond to any issues that are caused by these delays. We really appreciate that vaccine providers have also been working amongst themselves, working together to prevent any cancellation of appointments across the state. So members of CDPHE as well as DHSCM are working together to get all of the doses coming into the state into arms across the state. We are staying in tune with how national vaccine supply may increase in the coming weeks, including existing and potential new vaccine manufacturers and types. We are planning for various supply scenarios as that supply increases to ensure we're capable of maximizing all of our providers' capacity, and also with introducing new ways to get more vaccine doses into arms. Our call center is very active. We're handling over 1,000 calls per day, and now our average time to answer those phone calls is down to 7 seconds. So just a reminder for everyone that that number is 1-800-CO-VAX-CO, CO-VAX-CO, and our staff is helping people understand how and where to get the vaccine and answering other questions as they come in. That is all that I have, so you can move on to the next slide.
Great, thank you. Kevin, we'll go ahead and take it over to you.
All right, good afternoon. Thanks for being here. It's been a while since we've talked about PPE, which is a good thing. But I just wanted to give a brief update so you understand where we are with it. You know, a year ago, PPE was really what we were trying to get. And now the State Emergency Operations Center manages 2 warehouses, and we have a sufficient stockpile of PPE. And we've been delivering it, but we're also maintaining enough to make sure that we have PPE for future needs if we need it, and also to make sure that state agencies have PPE on hand for any of those that are going to be dealing with patients or the public and would need that for their work. One of the things I'd like to highlight is our school mask program. So part of our efforts to get in-person learning going is to deliver masks to educators. And it looks like we'll have over 8 million masks delivered to schools. So we're very proud of that program, and we'll be continuing that to make sure that we're doing our part to get in-person learning going. If we go to the next slide, please. All right, alternative care sites. Our big thing there is that we are in the process of decommissioning the sites. We looked at them as our insurance policy, and now our epidemiological models are suggesting that we're going to stay below our hospital capacity. So that's a great thing. We always looked at it as an insurance policy to make sure that we had that. And that we were able to do what we could to make sure that we open up the economy to the extent possible while maintaining our healthcare capacity, and those were an important part of that. We're really peaking there, and we're concerned that we may have to do them, but the good news is that we didn't. And as you may have heard, that these alternative care sites are now 100% reimbursable by Fema. So that's great news. The governor advocated for full reimbursement on these program expenses over the last year, and now we've got it. So that's a great thing. And now, as part of our decommissioning those, we're working to make sure that we're recycling what we can. We've got a big recycling effort from the metals that we put in there, making sure that we're doing everything we can to keep waste out of landfills, but also repurposing the equipment that we put in there. We've got equipment that we've put in for future use. We've got showers. We've got other equipment that we're working on. And we're also using some of the stuff that we've had to put into other uses in the medical industry, and also for future use, such as cots for new disasters coming up. So we're working hard on that. We're still not out of the woods, so everybody's got to do their part to protect others, wear masks, wash your hands, socially distance, and limit exposure to others until we're through with all of our vaccinations. So thank you for your time, and I think we're going into Q&A.
Yeah, we can go right into the Q&A. So if you have a question, we'll use the raise hand function, and I will call on you. I would say if you have a question outside of what we've discussed today, if you'd like to send that over to media_info@state.co.us, that'd be great, and we can get to you. I want to get through as many of you as I possibly can, so if we can go ahead and go with everyone's first question and hold your second and follow up for the next round, that would be wonderful. And we'll start with Mark. If you could say your name and which outlet you're with.
Hi, this is Mark Salinger with 9 News. The Biden administration has said that they're planning to increase the supply of vaccines to individual states and to states as a whole. And I was wondering, if that supply goes up, is Colorado prepared to handle more vaccines and more vaccination sites? And I don't know if you have a specific number, but how many do you think that you could handle on a weekly basis?
Well, I can take that initially. So to answer that, so I'll just say the week of March 7th, so the first part of March, we're actually increasing to 218,000 doses for that week. So that's an increase that we're seeing. Right now, like I've said before, that usually during flu season, the state easily handles 250,000 doses a week. So right now, with what we're seeing from our providers, and the capacity that they have, just right now with current structure, about 300,000 a week, maybe to 350. And then we are currently planning other avenues, including large mass vaccination sites around the state that we're currently planning that will be both state run and then possibly some FEMA run. And we'll have more information about that later, but that's certainly what we're planning on, so that we are capable of receiving 300 and administering 350 to 400,000 per week.
Great, thank you. Seth, we'll take it over to you.
Hi, thanks. Seth with the Gazette in Denver and Colorado Springs. Does the state have a sort of percentage goal for how much of the next group, phase 1B3, they want to have vaccinated, similar to the 70% for 70 and older? Is there a target or goal like that identified for 1B3? Thank you.
I can answer that again. No, there is not a goal right now. 1B3 is large. We're talking 1.15 million. It's a very large group with when we're talking essential workers. So we do not have a goal set out there yet. What we're really waiting on is how much vaccine we'll have, when the Janssen vaccine the emergency use agreement will be approved, and when we can start receiving that vaccine, and then how quickly we can set up vaccination sites. And then, of course, with essential workers, it's working with unions, it's working with employers, it's working with any organization that represents those workers on getting them vaccinated as quickly as possible. So we'll definitely have more information on that as we get farther on down the road on phase 1B3.
Great, thank you. Patty, I'm going to take it over to you.
Hi, this is Patty with the Associated Press in Denver. So I just wanted to get a little more clarity on the numbers. So on Tuesday, CDPHE said 133,000 vaccines were delayed. And then Kate said that we should be receiving most between today and Saturday. So can you be a little more specific? How many vaccines of those that were delayed are we going to receive?
Sure, I can answer again. Hey, so what we have right now is, so for Pfizer, we actually had 79,560 delivered this week. We expect 15,210 doses by Friday, with another 5,850 doses on Saturday. We don't have as good information about Moderna. They had some more problems there, especially where it's made. Right now, we have 51,000. Well, we received 46,420 doses of the Moderna, and we have 51,260 doses that we expect on Saturday, no later than Monday, is what we're getting right now. But we're hoping that most of them are delivered on Saturday, and we'll have more information later tonight, early tomorrow morning, as we get more shipping documents from the CDC and from FedEx.
Great, thank you. Matt, I'll take it over to you.
Hi, it's Matt Morrow with Fox 31 in Denver. Quick question about the Walmart vaccine distribution. We've heard from a couple of people that at times the pharmacists are not scheduling the second vaccine, and these people are having to go schedule it themselves and are struggling. Have you heard of that? And is the state trying to address this?
Yes, we did hear about that. We got reports of it, and we brought that up to the Walmart executive leadership this morning. that we would like whenever a first dose is administered, that a second dose is scheduled. That's our current policy. So we're working that with the Walmart Corporation right now.
Great, thank you. Chris, let's take it over to you.
Chris Van Deveen with 9 News. I just want to get a sense of, as the state sort of ramps up its vaccine distribution and more distribution centers open up as well, is there a process that CDPHE is going through to vet vaccine distributors to make sure that they're capable of distributing the vaccine that you're giving them?
Yes. The contracts will only be cut with the largest providers that we have, or providers that can actually do it. It'll be a combination of providers who have the scheduling capability, because that'll be key for these mass vaccination sites. And then also, and some ambulance services in the state too will also be involved with that. The scope of work is being developed along with the contracting done on that. It'll be a competitive bid, as there's done in any state process, and we'll move from there. It's definitely got to be with providers that have the capability to schedule it, to handle the dosage, and to administer it.
Great, thank you. Conrad, we'll take it over to you.
Yeah, thank you. Hey, I know Denver Mayor Michael Hancock was asked to be able to vaccinate people experiencing homelessness earlier than they might otherwise be eligible because they're at an elevated risk. Some public health experts have also raised similar concerns with me for people in jails and prisons. First, are there any other cities or counties that are making similar requests? And can you give me some insight into why state officials won't allow those types of deviations for people who are at an increased risk of contracting the virus and suffering more severe symptoms if they do contract it?
Scott, did you want to do, or did you want me to take that?
I go ahead, Kevin, and I'll add in if there's anything.
So I think it's important to understand that their priorities still stay the same, right? So when we're looking at 78% of the COVID fatalities are people 70 or over, whether they're experiencing homelessness or not, they're still eligible to get the vaccine. So we want to make sure that we're hitting our priority groups to get as many lives saved as possible when we have a limited amount of vaccine. So we understand that there are other priorities that need to be met, but right now our number one priority is getting it into the people where we're going to save the most lives. So that's really what the driving force is. So as we work through our priorities, then we'll get there. But right now our priority is saving lives.
Great, thank you. And Nusha, we'll take it over to you.
Hey, this is Anusha with 9 News. I just wanted to clarify regarding the variants that have been detected in Colorado so far. Are we still in a position where these are the variants that our vaccines are still effective against?
Yes, that is correct. So the variants that we have identified in Colorado include the B117 variant, which is also known as the UK variant, and then the L452R variant, which is a variant under investigation. And neither of those variants have been associated with decreased vaccine effectiveness or treatment issues.
Great, thank you. Seth, let's go to you.
Thanks, Seth at the Gazette again. Just a quick follow-up. General Sherman, you talked about the vaccine shipments increasing the first week of March. Is that just going to be for that week, or is that going to be sort of this ongoing vaccine improvement?
Unknown at this time. What we do know is that it's not going to be decreasing. We don't have what the amounts will be past the week of March 7th. At this time, and we'll get that data as soon as we know it. We'll know what it looks like. The week ending March 14th. We'll have that data late next week.
Great, thanks.
Sure.
All right, Matt, we'll go to you.
Hi, it's Matt with Fox again. A couple of days ago, maybe a week ago, Dr. Anthony Fauci said that he thought April could potentially be open season for vaccine. Does Colorado see that as well, where it would be open to the general public and not someone in a certain group?
Well, actually, Dr. Fauci's actually walked back those comments. He's now saying May. He's corrected that. So, unknown at this time. Do we want to be that way? Absolutely. The more vaccine we can get, that's where we want to be. We want to get every Coloradan vaccinated as quickly as possible. We just don't know the allocation right now. We don't know when Janssen will come online, which will be a huge help for us, but also when Moderna and Pfizer, when they'll actually start producing 1 million more a week. We're expecting that mid-March, but right now we don't have any more data.
Great, thank you. Chris, let's go to you.
Chris Vanderveen with 9 News again. Quick question on the variant strains. Do you all subscribe to the idea that, let's say by mid-March, sometime in April, there's been a lot of epidemiological, whatever the word is, talk about that the variant strains, particularly the UK strain, may become the dominant strain in the United States? Is there the thought that that strain could become the dominant strain in Colorado around the March-April timeframe?
It's a great question, and it's a question that I think we are also trying to get some clarity on. Those estimates and what CDC has said is that they believe that the B117 variant could become the predominant variant in the country, so meaning more than 50% by mid-March. But they also have said that they don't expect the experience to be the same from state to state. They expect that we will see some states that have a greater prevalence of variants than others in that time frame. Specifically, they've been talking about the fact, and there's been some published literature talking about the fact that we're seeing higher rates of the B117 variant in Florida and Southern California. So at this point, I think it's difficult for us to know if Colorado would be on that same timeline or not. What I think we have going in our favor is that we continue to have high levels of transmission control, and the same strategies that we use to suppress transmission of COVID-19 in general are certainly going to work as well for suppressing transmission of variant strains and slowing the emergence of variant strains in Colorado. So, we continue to recommend all of the things that we've been recommending to not just prevent COVID transmission in the state, but also to prevent and slow the emergence of some of these variant strains.
Great, thank you. And then Lucy, I believe you have a question, but I couldn't see your hand, so we'll just go ahead and go to you.
Yeah, hi, thank you. Lucy Haggard from the Colorado Sun. I wanted to go back to that school mask program. Are the masks for kids or staff or both? And then how are they being distributed within the schools?
So, they are for the educators and any staff that are student facing, right? So anybody that's going to have interface, whether they're a teacher or a nurse or any of the allied. And those are the ways that we're doing it. So we send it to the districts and then they deliver it to the staff.
Great, thank you. Okay, I'm going to do a last call. You guys were so great at asking your first question. If anyone has any additional questions or any follow-up questions, now is the time. All right, Lucy, I think you had one more.
Yeah, please, thank you. I was wondering also with the vaccine providers, how are they being compensated? The vaccine itself is, of course, free, but how are, Walgreens, Walmart, Kroger, et cetera, being compensated for their time?
Well, as of right now, so the long-term care facility program, that was a federal program. So Walgreens and CVS were compensated for that. But for everybody else right now, that's out of the goodness of their heart. They could bill if somebody has health insurance for the actual administering the vaccine, just the costs there, certainly not the costs, because that's free. So they are able to get some of their costs reimbursed there. But Really, it's been just working with them and out of goodness of their heart. And that's what we're working on as we get it for points of distribution or larger mass vaccination clinics. We'll be working on when we're talking contracts, it'll actually be a agreed upon price per person, so that they're not taking on the full cost of that site.
General Sherman, I'll just add to that we're also working with those providers that would be eligible for FEMA reimbursement now. So we have got many of them as sub-applicants if they're eligible. And that includes a lot of our big providers, right? So there are nonprofits that would be eligible, nonprofit healthcare providers. So we're working with them directly on what is available for them through FEMA. We're working with FEMA on that, and then we'll work that with our contracting plus the FEMA sites that we may end up with in the future. So we're hoping to make sure that we're making our providers whole. The other thing I just wanted to reemphasize is that nobody should be paying for vaccine, right? So that for individuals, if somebody says they're going to charge you for vaccine, look someplace else, right? So one of the important things is that we are, providing the vaccine, and we're providing the people that provide the vaccine. So that's one thing I want to emphasize.
Yeah, there should be absolutely no discrimination if somebody has health insurance or not. It's everybody's welcome. Get the vaccine, and especially with the hospitals, they don't have to be a customer or be affiliated with that hospital. It's open to everybody, fair and equitable across the board, so that all people are getting vaccine.
Great. Matt, I think you have a follow-up. Let's go to you.
Two quick questions, if I might. Thank you. One, how much is the genetic testing is the state doing to try to find these different variants, and how much they're circulating in Colorado? And you've talked a little bit about FEMA. How much assistance are you getting from FEMA in terms of financial assistance and possibly people to come in and help with some of these big vaccination events? Thank you.
So I can answer the first question. So it really depends on which variant you're talking about. So the B117 variant, there's essentially a screening test. So regular PCR tests, if they're done with a specific brand of PCR, the Thermo Fisher assay, we're able to identify this S gene target failure profile. So the PCR result looks a specific way. And so it helps us sort of screen for specimens that might be most likely to be this B117 variant. In the state right now, we think that between our state lab, which is doing about 10 to 15% of the testing, and commercial labs that are also using the same Thermo Fisher assay, that we have about a third of the state covered. So a third of the specimens, a third of the positives that we're seeing in the state, at a minimum, I would say, are using this assay and able to identify this signature profile. With the other variants, that's where we really have to exclusively rely on whole genome sequencing, and that capacity is more limited. The amount of sequencing that Colorado is doing is actually quite impressive compared to other states across the country. At this point, we are doing about 200 to 300 specimens per week. And so that's the number that we're really looking at to try and identify these novel variants that are different than the B117 variant. So that's really how we're identifying these L452R variants in the state. And the way that we're also looking for other variants that could emerge in the state. So the P1 variant or the B1351 variant.
On the FEMA question, hundreds of millions of dollars in FEMA support. And right now the president announced that it's 100% reimbursable. So we are getting a lot of support from FEMA on that. And as I was talking about earlier, we'll work with those eligible applicants that will be able to receive that. And our turnaround on that time is pretty fast. What we can't do is duplicate benefits. So if it's available in another federal program, FEMA can't cover it. but we're working with CDPHE, with General Sherman and the task force, and with providers to make sure that we're identifying the ones that can take advantage of that, and do the best we can to make them whole. But the work that they've done, in advance on that, out of the kindness of their hearts to start with, is really impressive. And, we're very, very grateful for all the hard work and huge numbers of vaccines that they've put in there without any contracts from us. They're doing it now, and then we'll work those financial agreements with them as we go on.
Great, thank you. Patty, let's go to you.
Hi, going back to the Tennessee shipment delay, how many vaccine appointments had to be canceled as a result of the delay, if you could?
So far, not any. We were able to, I remember last week, we got some Pfizer and some Moderna ahead of time due to the long weekend. We've worked that out. And then our providers are working with each other to make sure that there aren't any scheduled appointments, and really appreciate the effort they've done working together to make sure they all have enough vaccine so there aren't any appointments that they have to be canceled.
I think I saw in Pitkin County, there was supposed to be a vaccine clinic on Friday that had to be canceled. Is that not the case anymore?
I don't have that information. I'll have to get back with you.
Okay.
I don't have that. Yeah.
All right, thank you. Okay, I think that we have got through all of your questions and your follow-ups. If there's something that we didn't get a chance to answer today, please send that over to media_info@state.co.us. And before I close out, do any of our speakers have any final thoughts they want to add? If not, no worries. We'll send everybody on their way for the day.
Thank you for your time.
All right, so with that, thank you to Dr. Rachel Herlihy, Kate McIntyre, Kevin Klein, and Scott Sherman, as well as our interpreters. And I hope you guys have a great rest of your day. Thank you.